Good morning and welcome back to the Fireside session at the Raisina Dialogue 2022. Today we are going to be talking about the great unleveler, lessons for public health from the pandemic. To talk on it, we have a great panel. Let me introduce them to you. We have Dr. Alakija. She's the co-chair of the African Union's Africa Vaccine Delivery Alliance, and she's the special envoy and co-chair for ACT-Accelerator, the World Health Organization. We have Dr. Sridhar Venkatapuram. He is an associate professor and deputy director at King's Global Health Institute. And we have Jean-Pierre, senior advisor from Global Health Strategies. Ma'am, I would like to start with you. Can you tell us that how should authorities navigate the tensions between livelihoods, human rights, and public health?
There should be no tension between livelihoods, human rights, and public health. Human rights are human rights. Health is a basic human right. Livelihoods are a basic human right. So that there's this inability at the moment to walk and chew gum at the same time, to do two things at once, and we seem as a world to feel as though that we need to focus on one thing or another. But maybe the one thing we should focus on is the right to life, the right to dignity, the right to health, the right to education, the basic rights, the right to be able to earn your own living. And I think as a global society, we're losing the ability to focus. You know, right now, as you mentioned, I'm working on the COVID response and dealing with health equity and health justice from that perspective. And there are those who would say that, oh, well, we can either vaccinate people in the low-income countries of the world, or we can work on their health systems. When did we lose our ability to do two things at once or three things at once? It is not an either or. Life is not either or. We don't choose to sort of live or die. We choose to live the best life that we can. The very definition of health is a sense of well-being, a full social, economic, mental, everything. The wholeness of who we are as people needs to be encompassed in the wholeness of how the world addresses the issues of today. And no, we cannot look at one or the other. We have to pull all together. Human rights are human rights, and all of those things you've mentioned are all basic human rights.
I can't agree more with you, ma'am. Dr. Sridhar, if I can ask you, how can the practice of public health ethics help avoid the costs and the benefits of interventions like lockdowns being unequally distributed across the society?
Thank you very much. I think usually what happens is that when we have an infectious disease outbreak or an epidemic in a national country, there seems to be some sort of ethical trade-offs between protecting the greater health versus sort of what we do about the rights of the few people that are affected. In this pandemic, what's happened is that there was, from the beginning, an assumption that somehow everybody was at risk, and so we're going to try to balance sort of the health of everybody versus all the other things that they're going to have to give up in order to protect their health. I think what we have seen in this pandemic is governments taking many of the wealthiest countries taking a view that aside from trying to protect people from harmful infectious disease, we're also going to support people as they sort of stay inside. So we had massive financial support to individuals and corporations. We had public services still being supported. We had extra resources being put into lots of other programs. So in effect, we saw many of the richest countries making an ethical commitment to not let people suffer during the period of time that they are locked down. Unfortunately, many of the low and middle income countries didn't have that kind of resources to be able to support those individuals. I think this is one of the things that we need to address is in the future, how do we protect everybody in every country, both in terms of a dangerous, harmful infection, but also to be able to live decent lives during that period of time. And the second thing that I guess I would say in terms of the ethics and what can public health ethics do during sort of lockdowns, I think one of the things that we really lost here is this understanding that life isn't just one thing. Life is about many things. You are social, you will practice your religion, you practice sports, you practice arts, you practice all these things. And this pandemic has really brought to people that their life is multidimensional. And I think many governments need to recognize individuals and their citizens as having these complex and multidimensional lives. And how can we address not only pandemics, but health, while also recognizing all these different dimensions in people's lives?
I agree. Sean, if I can ask you, is the experience of the COVID-19 pandemic taking us towards new innovative tools access? And when it is very clear that scientific innovations is a necessary condition, but also at the same time, it's not sufficient one to save lives.
Yes, thank you for the question. We've seen that innovation has taken a greater role, not just in health, but in every part of society. And the impact of technology has been undeniable. If you look at the speed at which the world and the medical community has been able to deliver vaccines, no one thought that within 12 months we would have effective vaccines against COVID. The community, scientific community, the private sector, the public sector joined forces to make this possible. So this is one of the lessons that we've learned. We've also learned the lesson that whatever technology and innovation enable have to be shared more equally and with more equity across. We've seen the countries in the north hoard vaccines when the countries in the global south needed those same vaccines. We're seeing today a rush to manufacture vaccines in Africa, for example, at a time when there is a vaccine glut and where countries are declining basically vaccine purchases because they just don't see the needs. So we'll have to make sure that whatever innovations come, whether it's mRNA technology and how this facilitates manufacturing in developing countries or other technology, really is matched with sensible policies related to demand. And this will have to be strategically organized and focused. We just cannot let innovation run amok for the sake of having innovation. There needs to be a strategic plan to manage innovation, manage those technologies to deliver for the greater good.
Thank you. If I may commonly ask a question to all of you, has the pandemic made human civilization more prepared to face shocks that may impinge in the future? If I may start with you, Dr. Alakija.
No, is the simple answer to that, and also to respond in speaking to that to that point, to a little something that Jean-Pierre said. I think the challenge that we have is not that we've had. The challenge that we have is not that innovation has overtaken us or that we haven't balanced demand with innovation. The challenge we've had speaks to the ethics that Dr. Sridhar talked about earlier of this moment in history. You know, you said, are we more prepared? No, we are not more prepared, because the reason right now there is supposedly a vaccine glut and countries are not taking them up is because when we had vaccines and when the high-income countries of the world hoarded those vaccines, had we released vaccines at that time, had we pushed demand, the drive for demand for vaccines, had we delivered, had we gotten vaccines from ports to arms at the same time as we were doing it in New York, in London, in Paris, then we wouldn't have a glut, because there wouldn't have been this dichotomy. There wouldn't have been this sense that, well, those people are better than us, and then the global north has driven the conversation. So because it is felt now that the pandemic, for those in New York and Paris, people are getting on with their lives, it's over. Those who were not vaccinated, however many months ago it was, a year ago, are beginning to think, well, so why are we doing this again? You all say it is over. So we are not more prepared to absorb shocks. We're in a critical time in history as a human race. We're in a critical time as we have the nexus between COVID and conflict, competing crises, a climate catastrophe. We have so much that is ahead of us. But if we do not begin to treat each person, each human life as equal, if a life in New Delhi is not thought to be as equal as to a life in New York, then we as a global community have a problem. The core of this is equity. The core of this is justice. The core of this is treating each human being the same, be it in humanitarian crisis situations, as the world rushes to help people coming out of the Ukraine, quite rightly, but there are also people coming out of Tigray in Ethiopia. There are also people in Yemen. We are not ready, and we also need to have those hard conversations so that people understand where we are at this moment in history. We are back to 1944, 1945, when the Bretton Woods institutions were formed. We need a new world order.
Dr. Sridhar, your thoughts?
I just want to say, I agree absolutely. So just picking up on this point, I would say that, I'm going to be silly enough to say is that the current global order is not good for health. Yeah. And it's not good for the health of the majority of the people on the planet. It might be for some populations in some countries. I think that's one fundamental and overarching issue of the future of health and pandemics. The one thing that I would focus on is that I think a fundamental error in the few people that decided how we're going to respond to this pandemic in the beginning was that they thought that this was a biomedical problem, and so they thought the solution was a biomedical solution. I think fundamentally we are not ready for any other future shock or pandemic, because we are not ready to recognize that the cause of infectious diseases and chronic diseases are social causes. And so this virus arrived on this planet because of various kinds of social decisions that were made in that context. It traveled through airplanes, which is a socially created thing, and within countries because of various kinds of failures and neglect in social policies. And so the future of preventing the next pandemic is not let's invest money in making sure there's a vaccine in the first 100 days. It's let's address the drivers of the next infection. What are the social inequalities that drive vulnerability, that drive people infections? So until we have an understanding and a commitment to address those social conditions that allow infectious diseases to spread within and across countries, we're not going to be preventing the next pandemic.
Sure.
Well, I mean, we know history repeats itself in cycles. And I remember joining Gavi in the very early days of Gavi, and Nelson Mandela was already saying that whether a child lives or dies should not be a function of where he or she is born. He was saying that vaccines would protect us all or protect no one. We're still saying all of these things today. And repeating them. We have not learned sufficiently. Even more in pragmatic terms, I was looking at some of the early plans for manufacturing vaccines in Africa. They were laid out in 2007 with the Pharmaceutical and Manufacturing Plan for Africa, which was proposed by the AU. What have we done since then to prepare the world for the current pandemics? What are we doing today to prepare for the future pandemics? They're inevitable. So let's collectively learn that, as you said, Sridhar, there's not just health problems. There's societal problems that we're tackling. And as such, we have to tackle them in a more holistic way, and making sure that everyone benefits from the innovations and the technologies we were discussing, and not yet again take a step back to 15, 20, 25 years ago saying, oh, but we need to vaccinate the world. No one will be protected if we're not all protected. So let's hope that we learn. I'm more optimistic than my sister because it's in our nature, but at the same time, we need to be very realistic that we haven't so far. So let's kick in, all of us, and make sure that their learnings are shared.
Thank you so much. I think I totally agree that we should have collective thoughts of how everybody could be saved and how we can protect ourselves from the future shocks of pandemic. Thank you so much for sharing your thoughts.
Thank you.